how many of your patients with HFrEF have diabetes? And do you believe ARNI has benefits in changing the course of the severity of diabetic illness and reducing the need for insulin? Now, this is a very important aspect that we are going to focus on. So firstly, I think we find that in India particularly, a significant number of our patients with heart failure are diabetic. In fact, we find diabetics who have normal coronaries and severe LV dysfunction. So we are very sure today, and we have seen many such patients, and they were therefore part of all our large registry data, whether from North India or South India. What they found that half the patients, 55%, hospitalized for heart failure had diabetes. So diabetes is a very common companion of our heart failure patients. And in these patients, I would like to remind you, as this slide shows us, that the prevalence is very high. All over the world, they have shown between 15 to 41% of our patients who have heart failure. And one must remember that various trials have shown that GLP-1 and SGLT2 inhibitors, they also are very beneficial for treatment of heart failure in these groups. Of course, SGLT2 inhibitors, as we all know, have been now demonstrated to show benefit in non-diabetics too. Now, ARNI, in all both the spectrum, the entire spectrum of HFrEF, it reduces cardiovascular death and heart failure, and it does equally well. It performs equally well in diabetics as in non-diabetics. Now, the effect, this is something very important. We knew that ARNI in the Europa trials, the ACE inhibitor was shown that if you put a patient on ACE inhibition, he has a less chance of developing diabetes. We have now evidence to show that ARNI also has a favorable effect on glycaemic control, and changes in the mean HbA1c and the levels of sugar, they are very, very favorably influenced by ARNI therapy. And this change has been shown in trials to be more than what is seen with enalapril and other ACE inhibitors. Now, when it comes to use of insulin, we find that less number of people who are on ARNI require insulin. And as this trial shows us, that this difference is as much as 29 to 30%. So 29 to 30% fewer patients were started on oral hypoglycemic agents with ARNI, vis-a-vis enalapril.